Every single day, thousands of older adults wake up feeling perfectly fine. They make their coffee, they walk to the bathroom, they reach for something on a shelf. And then it happens. One wrong step. One split second of lost balance. And suddenly, everything changes. A fall. Not a stumble, not a near miss. A real fall. On the floor. Alone. Sometimes unable to get back up. And here is the thing that nobody tells you. That thing that your doctor may have never once mentioned. Falls are not random accidents. They are not bad luck. They are not just one of those things that happens when you get older. Falls are warnings. They are your body sending you a very specific signal that something has gone wrong deep inside. Something that started years before you ever hit the floor. Something that is completely fixable if you know what to look for. And today, that is exactly what you are going to learn. Because there is one simple exercise, just one, that is so powerful, so targeted, and so easy to do that researchers and physical therapists are calling it the single most important thing any person over 70 can do every single day to stop falls before they ever happen. You do not need a gym. You do not need special equipment. You do not need to be in perfect health. In fact, people with bad knees, bad hips, and even mild arthritis can do this. And what happens to your body when you do it consistently will absolutely surprise you. Stay with me, because what you are about to hear could change everything. Let us start with what most people believe about falls. Most people, and most doctors, frankly, treat falls as a mobility problem. They think it is simply about weak legs, or slippery floors, or bad shoes. And so the typical advice goes something like this. Use a cane, hold on to the handrail, be more careful. That is not wrong advice, but it is incomplete advice. And incomplete advice does not save lives. Because here is what most people do not realize. By the time you actually fall, the real problem has already been building inside your body for 5, 10, sometimes even 15 years. The fall is not the beginning of the story. The fall is the end of a long, quiet, invisible process that has been happening in your muscles, your nerves, your brain, and your inner ear. And nobody ever told you it was happening. And here is what changes everything. The real cause of most falls in people over 65 is not weak legs. It is not slippery floors. It is not even poor vision. Though all of those things do play a role. The real cause, the hidden engine driving most falls, is something called proprioceptive decline. Say that word slowly. Proprioceptive decline. Most people have never heard of it. Even people who have been to dozens of doctor appointments, people who take care of their health seriously, people who exercise regularly, most of them have never been told about this. And that is a problem, because once you understand what proprioceptive decline actually is and what it does to your body, you will never look at balance the same way again. Let me explain this in a way that makes complete sense. Close your eyes for a moment and imagine that your body is a giant orchestra. Dozens of musicians, all playing together, all watching the conductor. Now your balance system is not just one musician. It is not just your legs or your feet. Your balance is the result of 3 separate systems working in perfect harmony. First, your eyes. They tell your brain where you are in space. They see the horizon, the floor, the walls. They help your brain orient your body. Second, your inner ear. Deep inside your ear, there are tiny fluid-filled chambers that detect movement and tilt. They act like a built-in level, like the kind a carpenter uses to check if a shelf is straight. Third, and this is the one nobody talks about, there are specialized sensors buried in your muscles, your tendons, and your joints. These sensors are called proprioceptors. They send constant signals to your brain telling it exactly where every part of your body is located in space, without you even looking. When you take a step, these sensors fire. When you shift your weight, they fire. When you start to tip slightly to the left, they fire, and your brain immediately makes a tiny correction. A micro adjustment so fast and so automatic that you never even notice it. That is what keeps you upright. Every second of every day, a trillion tiny conversations between your body and your brain, happening faster than thought. Now here is where the hidden damage begins. After the age of 50, those proprioceptors start to slow down. Not dramatically, not all at once, just a tiny bit at first. A slight delay in the signal, a small reduction in the sensitivity of those sensors. It is so gradual that you would never notice it on a Tuesday afternoon. But by 65, 70, 75, that small delay has grown. The signals are slower, less precise, less reliable. And your brain, which depends on those signals to make those microsecond corrections, is now working with outdated information. Delayed information, like a GPS that is a few seconds behind reality. You are already leaning, but your brain does not know it yet. By the time the signal arrives, by the time your brain tries to make the correction, it is too late. That is a fall. And what makes this worse, what makes this situation so urgent for people over 70 specifically, is that proprioceptive decline does not happen alone. It teams up with other changes that are happening in your body at the same time. Let me walk you through them. Because this is where the real picture becomes clear. Starting around age 60, your muscle fibers begin to shrink. Not just the big muscles you can see, the biceps, the calves, the thighs, but the tiny stabilizing muscles that run along your ankles, your spine, and your hips. These tiny muscles do not move you. They hold you. They are the invisible scaffolding that keeps you steady when everything around you shifts. And when they weaken, even the best proprioceptive signals in the world cannot keep you balanced if the muscles responsible for acting on those signals are too slow and too weak to respond. At the same time, something is happening in your nervous system. The nerves that carry signals from your feet and ankles to your brain, the very nerves that process proprioceptive information, begin to conduct those signals more slowly. This is a natural part of aging. It is not a disease, but it matters enormously when it comes to balance. Think of it like an internet connection that has gone from fiber optic to dial-up. The information is still getting through, but not fast enough. And then there is your inner ear. The tiny calcium crystals in your inner ear, the ones that help detect gravity and tilt, can become dislodged or degraded with age. You may have heard of vertigo, that dizzy, spinning sensation that comes out of nowhere. That is often caused by this exact problem. When your inner ear is not working properly, it sends conflicting signals to your brain. Your eyes say one thing, your proprioceptors say another, your inner ear says a third thing, and your brain, trying to reconcile three different stories, becomes confused. That confusion is what you feel as unsteadiness, as dizziness, as the terrifying sense that the ground is shifting beneath your feet. And here is something that will genuinely shock most people watching this. Your brain itself changes as you age. The cerebellum, the part of the brain responsible for coordinating balance, timing, and smooth movement, loses neurons over time. It processes information more slowly. It takes longer to make decisions about body position, longer to initiate corrections. All of these systems, proprioception, muscle strength, nerve speed, inner ear function, and brain processing, all of them decline together, quietly, gradually, invisibly, until one day you reach for something on a high shelf and something just feels off, or you step off a curb and there is that terrifying lurch, or you wake up in the middle of the night and your legs just do not respond the way they should. Your body has been warning you. Most people just do not know how to listen. I want to tell you about a woman named Margaret. Margaret was 73 years old and had always been active. She walked every morning. She cooked her own meals. She lived alone and was proud of her independence. Then one winter evening, she got up from the couch to turn off a lamp. The floor was dry. The room was well lit. There was nothing unusual about that moment, and she fell, hard. She caught herself on the coffee table, but the impact still left her with a bruised hip and a shaken confidence. She went to her doctor. He checked her blood pressure, her medication, her vision. Everything seemed fine. He told her to be more careful and suggested she consider a walker. Margaret was devastated. She was not ready for a walker. She did not feel like an old woman. She felt like herself, like a person who had been active her whole life. But she did what she was told. She bought the walker, and she became more careful. And she also became more sedentary. She stopped walking as much because she was afraid. She stopped going upstairs. She started asking her daughter to come over for things she used to do herself. In 6 months, she had aged more in her muscles and her confidence than she had in the previous decade. What Margaret needed was not a walker. What she needed was someone to tell her the truth, that her balance system had been weakening for years, and that the right response was not to move less, it was to train those balance systems directly. She eventually found a physical therapist who explained proprioceptive decline to her, who gave her one simple exercise to do every single day. Just a few minutes. No equipment. Within 3 weeks, she noticed a difference. Not a dramatic one, but she felt steadier, more connected to the ground, more confident on stairs. Within 2 months, she had given back the walker. What changed was not her age. What changed was that for the first time, someone had addressed the actual cause of her problem. Now, before I tell you the exercise, and I will, very soon, I want to give you a way to test yourself right now. This is a simple, well-known balance test called the single leg stand. Physical therapists use it all the time to assess proprioceptive health. You can do it in your living room in 30 seconds. Here is what you do. Stand near a wall or a sturdy chair, something you can grab if you need to. Do not hold on yet, just have it within reach. Lift 1 foot off the floor, just a few inches. No need to raise it high. Stand only on the other foot. Count how long you can hold that position without wobbling, without touching the wall, without putting your foot back down. Most healthy adults in their 30s and 40s can hold this for 45 seconds to a minute or more without difficulty. But here is what research has consistently shown about balance and age. If you are over 70 and you cannot hold that position for at least 10 seconds, your balance system has declined to a point where your risk of falling is significantly elevated. Some studies have found that people who struggle with the single leg stand are up to 3 times more likely to fall within the next year. If you tried it and felt shaky or needed to grab the wall or could only hold it for a few seconds, please do not be discouraged. That is not failure. That is information. That wobble you felt? That is your proprioceptive system telling you it needs help. And the extraordinary thing is, it can receive that help. It can be retrained at 70, at 75, at 80. That is what I want you to understand. Your balance system is trainable, and the exercise I am about to share with you is specifically designed to do exactly that. So here is the simple daily exercise that can genuinely stop falls before they happen. It is called single leg balance training, combined with what experts call perturbation practice. And I'm going to walk you through it step by step, including exactly how to make it safe, how to progress it over time, and how to adapt it if you have knee or hip problems. Start with this. Every morning, after you wake up and before you sit down for breakfast, do this exercise. It takes about 5 to 10 minutes. Stand in your kitchen near the counter or a sturdy chair. Place your hands lightly on the surface, not gripping it, just hovering near it so you can grab it instantly if you need to. Lift your right foot just slightly off the floor. Hold it for 10 seconds if you can. Then put it down and lift your left foot for 10 seconds. That is 1 round. Do 5 rounds, alternating feet. Now here is the key. After the first week, you are going to begin making this harder in a very specific way, because this is where the real retraining happens. On week 2, do the same exercise, but close your eyes. When you remove the visual input, your proprioceptors have to work harder. They have to pick up the slack. They get stimulated more intensely. And that stimulation, that gentle challenge, is what causes them to sharpen and improve. It will feel more difficult. You may wobble more. That is exactly what is supposed to happen. Stay near the counter. Stay safe. But let yourself wobble a little. The wobble is the workout. On week 3, add another layer. Do the exercise on a slightly softer surface. A folded towel on the floor works perfectly. 2 layers of a bath towel, folded flat. When the surface becomes less stable, your proprioceptors fire even more intensely. Your ankle muscles work harder. Your brain receives stronger signals and makes faster corrections. This is called sensory enrichment. It is the difference between walking on pavement and walking on a hiking trail. Uneven, variable surfaces force your balance system to stay sharp, and that is exactly what this exercise simulates in a safe, controlled way. Do 10 repetitions per foot every morning. Just 10 repetitions, that is all. Now there is one more piece, and this is perhaps the most important piece of all. And it is the one that most balance exercise programs leave out entirely. It is called weight shifting, and here is how to do it. Stand with both feet on the floor, shoulder width apart. Shift your weight slowly to your right foot. Not all the way, just 70%. Feel the pressure under your right foot increase. Hold for 3 seconds, then slowly shift to your left. Hold for 3 seconds. Now shift forward, just slightly to your toes, then shift back to your heels. Slowly, deliberately. Feeling the shift in pressure under your feet. Do this for 2 minutes. What this does is extraordinary. It trains the proprioceptors in your feet and ankles to map your body's position in space with much greater precision. It literally redraws the map your brain uses to keep you balanced. Physical therapists call this center of gravity awareness training. And it is one of the reasons people who practice Tai Chi, that slow, flowing, weight-shifting exercise practiced across Asia, have dramatically lower rates of falls than people who do not. You do not need to learn Tai Chi, you just need to practice deliberate, slow, conscious weight shifting every single day. 5 to 10 minutes. Every morning, near a counter, near a chair, safe and steady and consistent. That is the protocol. And what it does to your body over the following weeks will genuinely surprise you. Let me tell you what to expect, day by day and week by week. In the first 3 to 5 days, you will probably feel awkward. The single leg stand will feel unsteady. The eyes closed version will feel nearly impossible. You may need to grab the counter multiple times. This is completely normal. You are not failing. You are simply revealing how much your proprioceptive system has been working in the background without adequate stimulation. It is like waking up a muscle that has been asleep for years. At around the 7 to 10 day mark, something begins to shift. Most people notice they are wobbling less. The single leg stand becomes a little more stable. The eyes closed version becomes slightly less terrifying. This happens because your proprioceptors are beginning to respond. The sensory neurons are firing more reliably. The connections between your feet and your brain are getting sharper. By week 3, something more meaningful happens. People begin to notice it not just during the exercise, but during daily life. Walking feels more solid. Stairs feel less intimidating. Reaching for something feels more controlled. That subtle sense of unsteadiness that many older adults have come to accept as just the way things are begins to fade. This is the point where many people feel genuine emotion, because they realize they had accepted something as permanent that was actually changeable. By 6 to 8 weeks, when people retest themselves with the single leg stand, the improvement is often dramatic. People who could barely hold it for 5 seconds can hold it for 20, sometimes 30 or more. The stabilizing muscles around the ankles and hips have strengthened. The nervous system has become more responsive. The brain has recalibrated its balance map. And falls, those terrifying life-altering events, become rarer. Not because you got lucky, but because your body has become better at catching itself before the fall ever happens. At 3 months, the changes can feel transformational. People describe feeling younger, more confident, more willing to go places, do things, engage with life fully. And the research supports this. Balance training programs specifically targeting proprioceptive function have been shown to reduce fall rates in older adults by as much as 30 to 40%. Not through medication, not through surgery, through targeted daily movement that reawakens the body's own built-in stability systems. Now I want to talk about something important. Something about the rest of your day. Because the morning exercise is the foundation, but there are other things you can do throughout the day that make that foundation even stronger. The first thing is to become a walker on uneven surfaces. Most of us, as we get older, seek out smooth, flat, predictable surfaces. And that makes sense from a safety standpoint. But smooth, flat surfaces do not challenge your proprioceptors. They allow your balance system to become lazy. If it is safe for you to do so, walk on grass, walk on a gravel path, walk on the sand at a beach. Even just walking on a lawn with small natural variations in the ground is profoundly beneficial for your balance system. Every time your foot lands on an uneven surface, hundreds of proprioceptors fire at once. Your ankles, your feet, your calves, all working together, all communicating with your brain, all practicing the very skill that keeps you from falling. The second thing is to reduce your dependence on handrails during balance exercises, not during daily life, not on stairs where you absolutely should use them, but during your morning practice. Learning to balance without a handrail, in a safe, controlled setting with a sturdy surface within reach, is training. It makes the handrail a tool rather than a necessity. The third thing, and this one surprises people, is to take off your shoes more often. Your feet have an incredible density of proprioceptive nerve endings, more than almost anywhere else in the body. But thick, heavily cushioned shoes block the sensory information those nerve endings are trying to receive. Walking barefoot in your home, on a clean, safe floor, stimulates proprioceptors in a way that shoes simply cannot. Even 5 minutes of barefoot walking indoors each day is beneficial. If you have circulation problems or diabetic foot concerns, please check with your doctor before walking barefoot. And in that case, thin-soled flexible footwear is a good alternative. The fourth thing is strength training for your ankles specifically. This is different from the balance exercise. Sit in a chair and write the alphabet with your foot, slowly tracing each letter in the air with your big toe. This looks silly, but it works. It activates every muscle and tendon in your ankle and lower leg in a controlled, varied way. Physical therapists prescribe this exact exercise for ankle rehabilitation and for fall prevention. Do one alphabet with each foot. That is it. Once a day. And the fifth thing, perhaps the most overlooked of all, is sleep. Your balance system does not just need exercise during the day, it needs rest at night. Deep restorative sleep is when your nervous system consolidates the learning from your daily balance practice. It is when your brain integrates the new proprioceptive signals and updates its maps. People who sleep poorly, fewer than 7 hours, or with frequent interruptions, have significantly worse balance than people who sleep well. This has been documented in study after study. If your sleep is poor, improving it is not just about feeling rested. It is about keeping your brain sharp enough to catch you when you stumble. I also want to mention something about nutrition and falls, because most people have never been told this either. Vitamin D deficiency is extraordinarily common in adults over 65, and its connection to falls is very well established. Vitamin D is not just about bone health. It directly affects the function of muscle fibers, including the tiny stabilizing muscles we have been talking about. When your vitamin D levels are low, those muscles are slower, weaker, and less responsive. Magnesium plays a role in neuromuscular function, the communication between your nerves and your muscles. Low magnesium can contribute to muscle cramping and impaired coordination. Protein intake matters enormously. After 65, your muscles become less efficient at using dietary protein for repair and growth. This is called anabolic resistance, and it means that if you are not eating enough protein, you are losing stabilizing muscle mass faster than you realize. I want to be clear, I am not saying supplements cure falls. They do not. Nothing does, except consistent effort over time. But if your body is nutritionally depleted, the exercise I have described will work less well, take longer, and produce less dramatic results. A good simple rule: eat some protein at every meal, spend a few minutes in sunlight each day if you safely can, and speak with your doctor about whether a vitamin D supplement is appropriate for you. Now, I want to address something that might be on your mind. Some of you watching this may have already had a fall, maybe more than one. Maybe a serious one that left you injured, shaken, or afraid. And I want to speak directly to you for a moment. Fear of falling is its own risk factor. This is something researchers have a name for. It is called fear-induced restriction of activity. What it means is that after a fall, people naturally become more careful, more cautious, more still. They move less. They go out less. They challenge themselves less. And in the short term, this feels wise. It feels like self-protection. But in the medium and long term, it is the opposite. Less movement means weaker muscles. Weaker muscles mean worse balance. Worse balance means a higher chance of falling again. The fear of falling, if left unaddressed, can paradoxically make you more likely to fall. The answer is not recklessness. The answer is not pretending the risk does not exist. The answer is targeted, deliberate, daily retraining of the very systems that keep you safe, with appropriate precautions, near a safe surface, at your own pace. What you are doing when you practice that morning balance exercise is not just exercising. You are reclaiming confidence. You are telling your nervous system that it is still capable, still responsive, still able to protect you. And the body believes you. It responds. It adapts. It improves. At 70, at 75, at 80, the research is clear. It is not too late. Before I close, I want to share a few important cautions, because I want you to approach this wisely. If you have recently had a fall that caused injury, a broken bone, a head injury, a significant bruise, please speak with your doctor or physical therapist before beginning any new balance exercise. You want to make sure the injury has healed appropriately and that the exercise is safe for your specific situation. If you have severe osteoporosis, a history of hip replacement, or significant joint pain, a one-on-one session with a physical therapist to learn how to modify these exercises for your body is genuinely worth the investment. If you experience sudden new dizziness, spinning sensations, or balance problems that have come on recently and feel different from before, please see your doctor promptly. These can sometimes signal inner ear conditions, medication side effects, or neurological issues that need to be addressed directly. And if you are taking multiple medications, please ask your pharmacist or doctor to review them for fall risk. Many common medications, blood pressure drugs, sleep aids, certain antihistamines, anti-anxiety medications, can impair balance and reaction time in ways that the prescribing doctor may not have specifically warned you about. This is not rare. It is actually quite common, and it is fixable. None of these cautions should stop you from beginning this journey. They should just make you begin it wisely. I want to close with something I think is deeply important. We live in a culture that treats aging as a one-way street, that says decline is inevitable, that fragility is destiny, that the fall is coming for all of us, and the only response is to be careful and wait. But that is not the full truth. The full truth is that your body, even at 75, even at 80, retains a remarkable capacity to adapt, to strengthen, to reorganize, and to improve. Your proprioceptors can fire faster. Your stabilizing muscles can grow stronger. Your nervous system can become more responsive. Your brain can recalibrate its maps, not because of a pill, not because of a surgery, but because of consistent, targeted daily movement that speaks directly to the systems inside you that were built to keep you safe. 10 minutes in the morning. Near a counter, near a chair, near something you can hold if you need to. Eyes open at first, eyes closed as you improve. A folded towel under your feet when you are ready. That is all. And in the weeks and months ahead, you may find that stairs are easier, that reaching for things feels steadier, that walking on uneven ground feels less frightening, that you move through the world with a quiet confidence that you thought you had lost forever. Not because you got younger, but because you got smarter about what your body actually needs. Your body is not giving up on you. It is waiting for you to give it what it needs. And now, you know exactly what that is. Take care of yourself. Take care of your balance. Take care of your independence. Because that independence is worth every single minute of those 10 minutes tomorrow morning.